First, I'm going to start by washing my hands. My name is Daniel, and I'm doing a head-to-toe assessment on you. I'm going to be examining your eyes, your ears, your mouth, looking at your skin, listening to your heart and lungs, and checking your abdomen out. Before we get started, can you tell me your name,
Brianna,
the year,
2019,
and where we're at?
hospital.
So my patient is awake, alert, oriented times 3. Before we get started, I'm going to check your blood pressure. Can you set that up? I'm going to bring you a little closer. Can I see your arm, please? Put your arm a little. I'm going to be placing my stethoscope on her brachial artery, if you can see that. Listening for the crock-off sound. Well, if I can get it right. Blood pressure is 110/78, which is a normal pressure for you. Does that seem normal?
Yeah.
Okay. First, I'm going to be examining your head and your eyes, and your mouth and your ears. So do you care to scoot closer for me? Okay. I'm going to actually move this back some. Okay, I'm going to be looking at your eyes. Can you look at me, please? You have a little ingestion, I see. Can you look at me, please? Okay. I'll be looking. Before I move on, can you please look into the distance? Can you please look into the distance? Okay. And tell me. You see my finger? Okay, so pupils are equal, round, reactive, and accommodative, and consensually to a light. I'm going to examine your ears. Okay. Light reflex is present, and the color is gray. Color is gray, and the light reflex is present there as well. Do you care opening your mouth for me and saying off? Okay. Do you care moving your tongue to the left? Look at your cheeks, your tongue, and the other side. Cheeks and tongue, and can you move your tongue up? And can you pull your lip down, please? Okay, mucous membranes are pink and moist, and I am not seeing any lesions noted. Set this down. Now I'm going to look at your skin. Can you hold your arms out for me? Okay, so skin color is normal for ethnicity, no jaundice or cyanosis present. Can you hold your arms out there for me? They're warm and dry. Check both sides. They're warm and dry also. While I'm here, I'm going to check the radial pulses. And they're equal and +3. While I'm here, I'm going to look at her nail beds and check for capillary refill. And they seem to be less than 3 seconds. Can you squeeze my hands for me? Good. Grip strength is equal +5. Now, I'm going to do the same thing with your legs. I'm going to pull this down here. So I'm going to hold for 5 seconds for any pretibial edema. And I don't see any pretibial edema. And I see no lesions as well on either side of your legs. No lesions. Skin is warm and dry. And can you warm and dry in this way as well? I'm going to check your pulses, repeated pulses. We've got to find them first. And they are equal and +3. Can you hold your feet out for me? And can you press against my hands? Okay, good. Plantar flexion is +5 and equal. And since I messed with your feet, I'm going to wash my hands real quick. Okay. Now on here, I'm going to listen to your lung sounds on your front and back. So, can you turn to the camera? And since I'm here, I'm going to check her skin turgor and her clavicle. And it seems to be brisk. So that means you're hydrated. Now I'm going to listen in to around 6 to 8 places on your front and the same on your back. Let's listen to your lung sounds. I'm going to listen above the clavicle because there's lung tissue here. Anytime I place my stethoscope, just take a deep breath. Good. Let me touch it. Good. Great. Great. Pull this down, keep your knee covered. Now can you pull up your shirt for me? Okay. Oh, knees, because I'm getting old. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. One more time. Now, you can lay your shirt down, and I'm going to ask you to hold your arm up. If you can see this, just turn for me a little bit so they can see. And deep breath. Okay, great. And do you care to turn around so I can listen to your back? You're doing good. You care to move your hair out of the way? Oh, my knees hurt. Okay, same thing when I place my stethoscope, just take some deep breaths. You could hold your shirt up for me. Pull that up just as well, just for me. Okay? And while you're here, our lung sounds are clear and equal. While you're here, I'm going to go to the 8th and 9th rib. And I'm going to have you take a deep breath for me. Okay, and respirations are symmetrical and equal. As well as you're here, can you turn to your side? Please, not lay down yet. I'm going to measure anterior posterior to transverse, and it's less than, which is good because a lot of COPDers getting barrel chest and the transverse will be, or the posterior anterior will be bigger than the transverse. You can go ahead and take a lay back. Okay. I'm going to pull you up real close. Oops. Okay. I'll just scoot down just a little bit. Okay, while I'm here, I see no heaves or pulsations, which is great. I'm going to take a listen to your heart sounds now. So first I'm going to start with second intercostal, right sternal border, which is your aortic. And you can breathe normal, by the way. Now I'm going to go to left sternal border, second intercostal, which is your pulmonic. Do you care to pull your shirt down just a little bit, staying covered? We got Erb's point, which is third intercostal, left sternal border. We come down to the fourth intercostal, left sternal border, and listen to your tricuspid. And I'm going to listen to fifth intercostal, mid-clavicular line. I'm sorry, I'm in your way. I'm here. I'm going to listen to, I'm going to listen to this for a minute, so hold with me. Starting right now. You can hold your shirt up. Pulse rate is 68. I counted. S1 and S2 are audible, regular rate and rhythm. Now I'm going to flip my stethoscope to the bell, and I'm just going to go back up those same places. So I'm going to start with the mid-clavicular line, fifth intercostal, which is the apex. Now I'm going to go to fourth intercostal, left sternal border, and listen to tricuspid. Now Erb's point, which is third intercostal, left sternal border. Now left sternal border, second intercostal, which is pulmonic. and then right sternal border, second intercostal to the aortic. You sound great. Again, S1, S2 is audible, no murmurs noted. Regular rate and rhythm. While I'm here, I'm going to take a look at your stomach. Do you care to pull up your belly? Let me look at your belly. Just pull it down for me yet. While here, I see no movements, no peristalsis, no wave-like motions, no pulsations. Before I start anything, do you have any tenderness anywhere? Okay. I'm going to listen into, the computer's getting dark now, I'm going to listen into the 4 quadrants with the diaphragm. Oh, you probably want to see this. Vowel sounds are normal active. Again, I'm going to lightly palpate your stomach. So before I get started, do you have any tenderness?
No.
Okay. So I'm using a one-handed technique. Okay. She has no guarding. I'm not feeling any masses, any palpable organs. I'm going to do the deep palpation. Tell me if you have any tenderness. Any tenderness? It also, again, has no guarding, no masses, no palpable organs. Also on her belly, I see no lesions. Her abdomen is soft, flat, color's normal for ethnicity. So you look good. Now I'm going to have you stand up and I'm going to look at your spine. Can you come this way? Oh. Okay. I'm going to first palpate. I feel spine. Do you have any tenderness?
No.
Nothing seems to be abnormal. The way she's standing erect, I don't see any lordosis or kyphosis. Can you go back and touch your toes, please? Feel her spine. It's midline. Do you have any tenderness?
No.
No tenderness noted. Spine's middle, so no scoliosis. I think there was one thing I forgot to mention. Can you sit down for 1 second? During her abdominal exam, her belly button, her umbilicus is midline, and with no drainage present, no lesions within her umbilicus. Is there any questions you have for me?
No.
All right, thank you. Thank you.